Hello, I'm Dr. Ruchika Nagrath and I specialize in antenatal care. So I hold these childbirth preparation classes for pregnant women. So I educate women about pregnancy and labor so they can take informed decisions for themselves during labor and postpartum. I would like to discuss the healthy birth practices that every pregnant woman should keep in mind for a healthy normal labor. First of all, let labor begin on its own. So while you are given an expected date of delivery, this is roughly 40 weeks. It is okay to wait for another week or two for labor to begin on its own. So if you are doing fine and your baby is healthy, there is no need to rush in for an induction. Wait for labor to begin on its own. Some critical development of the baby's brain and lungs takes place in the last few weeks of pregnancy, and you will not know until your labor begins on its own if that critical development has taken place in the baby or not. Second important healthy birth practice that I'd like to discuss is movement during labor. Unfortunately, a lot of women feel that when they go into labor, they should just lie flat on bed. Well, that's not the most healthy way. You should walk, move around, change positions for a fast, quick, healthy, normal labor. It will not only help you deal and cope with the labor pain, it will also help in getting your labor much faster. Each time you walk and move around, you're taking the help of gravity to bring your baby down, and it helps your labor move much faster. The next important healthy birth practice that I'd like to discuss is continue to eat and drink. So there are a lot of restrictions on eating and drinking when a woman goes into labor. Well, you should know that like going through labor is like running a marathon. Can you imagine running a marathon without eating, without energy? Definitely not. The same is with your labor. So eat, drink high carbohydrate stuff. This could be nariyal pani, nimbu pani, bananas, nuts, anything which will give you instant energy, juices. So feel free to eat light, high energy stuff during labor. This will give you the energy to go through labor. This will also help to relax you. Each time you eat and drink something, you're diverting your mind from pain, so it helps to relax you, and relaxation is very important for a fast labor. The moment you get stressed for some reason, or just if somebody tells you that your labor is not progressing well, if you get stressed, stress itself sets back your labor by another few hours. What happens is when you're stressed, the stress hormone is released. This hormone is anti the oxytocin hormone. Now the hormone that drives your labor is the oxytocin hormone. When you're stressed, the levels of this hormone goes down, so your labor just stalls. So eat, drink, relax, enjoy yourself during labor. After all, you waited for the entire process of 9 months. So be relaxed and your labor will progress very well. Another very important healthy birth practice that I'd like to discuss is continuous labor support. So make sure that your loved one, your husband, your mother or your sister, whoever you want with you, should be there with you in the labor room to support you. In fact, studies have shown that women who are well supported during labor do not feel the need for a cesarean or an epidural pain medication. It reduces the need for these interventions by 40%. Next important healthy birth practice is the pushing stage. Now, a very common practice, unfortunately, is to lie down flat on your back and push your baby. We at Lamaze recommend a non-supine position for pushing the baby. तो जब आप pushing stage पे हैं, try करिए कि आप bed पे flat ना लेटें. You could be sitting on your bed or या फिर side lying position में during the pushing stage, or you could be squatting. So these help in the pushing stage, they help you to push your baby much faster. So the length of labor is much reduced by taking the right positions during labor. Last but not the least, and the most important, is no separation of mother and baby right after the baby is born. So, जब the baby is born, the baby should not be sent to the nursery. The vaccination and the bathing and the cleaning of the baby, everything can wait. The baby should be just wiped and brought to the mother. The most critical time right after the baby is born is the first 1 hour after delivery. The baby is wide alert, the mother is also alert. The mother and the baby should be together so that breastfeeding starts and is successful. After the first 1 or 2 hours, the baby will doze off and sleep off. And that's when all the other care, like the vaccination, the cleaning and everything else, can take place. So again, I'd like to say, for a successful breastfeeding, that first 1 hour after the baby is born is most critical. No separation of mother and baby for the first 1 hour after birth.